My name is Courtney Bruning, and for my senior project, I researched the impact of kangaroo mother care on pain reduction in neonates. Through the examination of current research on KMC, I sought to analyze the following question. In stable neonates, what is the effect of KMC compared to alternative interventions on decreasing the behavioral and physiological response experienced during minor painful procedures? The issue of unresolved neonatal pain is very significant to the field of nursing. It is estimated that each day a neonate residing in the NICU experiences an average of 10 to 16 painful invasive procedures, and 40 to 90% of those neonates do not receive effective pain treatment. Further, typical pain meds such as opioids are not recommended for use in the neonatal population due to the difference in drug metabolism and the life-threatening complications that can arise, like respiratory depression. Long-term complications of unresolved pain for neonates can include intracranial hemorrhaging, organ damage, decreased pain thresholds, hypoxia, behavioral disturbances, abnormal emotional development, major psychosis, learning disabilities, and alterations in nociceptive neural circuits. In the studies I looked at, the participants ranged from 28 to 40 weeks gestational age, so not all of the participants were premature. In addition, all of the participants were hemodynamically stable and less than 2 weeks old. The studies I looked at used an experimental design, and the overall level of evidence presented was level 3, with weak to moderately weak quality. The findings of these studies consistently supported the use of KMC as an effective intervention to decrease the pain experienced by stable neonates undergoing a minor painful procedure, such as a heel lance or a vaccination administration. They also repeatedly demonstrated that KMC worked to decrease heart rate, audible and inaudible crying, NIP scores, PIP scores, and behavioral changes, while increasing O2 saturation and quiet sleep states. More specifically, the findings showed that KMC decreased pain intensity through distracting tactile and olfactory stimulation, alterations in cortisol and beta endorphin releases, the inhibition of certain pain pathways, and increases in oxytocin secretion. So more specifically, in a study done by Mosabi et al., it was found that PIP scores decreased by 3.1 points during heel lance administration when compared to a control group. Further, Ferber and Macau found that there was decreased motor disorganization, extension movements, disorganized sleep, heart rate variability, and O2 variability with KMC. Costandi et al. Found that infants using KMC spent an average of 41.1 seconds less crying when compared with an incubator control group. And Chohardy et al. Found that the mean heart rate increases were 4.4 beats less at 120 seconds, and SpO2 was 1.77% higher for infants in a KMC group when compared to an incubator control. Also, as you can see from this chart, this is the KMC group, and this is the incubator control group. This gray color right here represents no to mild pain, and as you can see, that's very high in the KMC group and quite low in the incubator control group. The light blue is moderate, and then the dark blue is severe, and as you can tell, it's almost directly opposite. So the KMC group, hardly any infants had severe pain, was in the incubator control group. A lot of the infants had severe pain. So after a thorough analysis of the literature currently available, a few recommendations were made. First, I would recommend that further research with larger sample size and a more conscientious effort to control internal and external variables is completed. This will make sure that the results prove that KMC is effective, and it will make it easier for units to implement their own evidence-based protocols. In addition, I feel that pilot projects utilizing KMC for pain reduction during minor painful procedures like heel lances and vaccination administration should be implemented in NICUs and labor and delivery units across the United States. I also strongly suggest that KMC is only utilized on hemodynamically stable neonates with no other conditions like skin lesions that could make the KMC dangerous for either the mom or the infant. It's very important that everyone stays safe when this procedure is being implemented. I also would suggest that each unit works to develop their own evidence-based protocol so that this can be put into practice. In general, these studies showed that KMC could be really effective in decreasing pain. For that reason, I think it's important to do the further research and implement the pilot projects because KMC would be minimally expensive, have a low risk, and it's something that could be independently carried out by nurses. So for this reason, I feel that KMC should be further researched.